Hi everyone, welcome to the webinar, COVID-19 and HIV, what we need to know. So we are here together because the pandemic that we have in our days, the COVID-19, and there's a lot of misinformation and concerns also with people that are HIV positive, and as well people that would like to know more about HIV prevention and in relation to COVID-19. Today we have some guests to talk about COVID-19 and HIV. We'll have from BHA for Equality, Nyambe from BHA Leeds, Chantel from BHA Manchester, Martin from Just House Trust, and Dr. Khine Phyu that will talk with us about COVID-19 and HIV. Martin, Nyambe, and Chantel will give us an update about the service, because the service changed a lot. So how people can have access to the service now during the lockdown, how can they, what service that now Just House Trust and BHA are offering in Leeds and Manchester, in Greater Manchester. This webinar is being recorded. So if you're not comfortable, it's important for us to record. So just to inform you, because then we can share this for training reasons, for people who'd like to know more about COVID-19 and HIV and were not able to be here. For a start, we'll start with Martin. Martin is for Just House Trust. He's going to explain about the service at Just House Trust. He explained a little bit of his work as well. Yeah. Hi, Martin, and thank you everyone today.
Thanks, Elizabeth, and hello. Thank you for having me here. Firstly, folks, it's always weird on these things. It's like, where do I look? Do I look into the camera? Do I look at everybody else's faces?
If you're comfortable, just feel comfortable. We are at home.
Yeah, I'll do my best. So yes, as Elizabeth said, I'm from Just House Trust. For those who haven't heard of the organisation, we provide advice, support and advocacy for people living with HIV, mainly in Greater Manchester. However, if there is anybody in the Northwest and they live somewhere where there isn't an equivalent HIV support service, then we will support them as well. But the vast majority of our service users are based in Greater Manchester or just slightly beyond. So thinking about how our services have changed, I suppose I'll just go through each of the main services and give you a wee bit of an update. At the end, I will post our phone number and links to the website. If people want to get in touch with us, they can do that in that way. We started working from home on the 20th of March, so it's been over 3 months now, so just a little bit before the lockdown came into effect. And since then, I would have to say as a team, we've been able to keep the vast majority of our services running in some shape or form. Maybe my partners and colleagues from BHA might say that, quite often things are different whenever it's done over the phone or over Zoom, but we're proud to say that 80 or 90% of our services are still happening in one form or another. So I'll just talk a wee bit about some of them or what we do. The kind of crux of what I do is one-to-one support. I'm one of 3 services advisors, and I would normally have about 10 appointments a week where I would see people face-to-face in our building. Those appointments have been happening now primarily on the phone, occasionally over Zoom. Not everybody has the technology to be doing that. And in the main, it's worked quite well. There's a bit of a difference between being in a room with somebody and giving them that space and being on the phone. But I've a lot of experience of doing that kind of work. And I'm still able to give people the support that they need. That could be of practical nature or connecting them to other services, or it could just be really listening to how people are, answering any questions that they have about HIV and COVID-19 to the best of our ability, or connecting them to other forms of practical support. So yeah, we're still around about the same level of appointments that we had before the crisis hit. Another service that is now up and running again is our counselling service. It took a wee while to get all things in place there. That is happening mostly over Zoom now, occasionally over telephone when people don't have access to Zoom. I run that service, and it's going well. There's a lot of kind of logistical things you have to consider when you deliver that kind of service, but I'm proud to say working through our waiting list, and if anybody who's already known to us needs counselling, then they can access that as they would have normally. Another service that is a form of one-to-one support that's happening still is peer mentoring. So our peer mentors are volunteers who are living with HIV and who use their own lived experience, but also the training that we give them and the skills and knowledge that they develop in the role in order to be able to provide social support in the main, but also to kind of talk about their own experiences and help people find their way, quite often with things like acceptance around their HIV status, how to navigate sex and relationships, although there's probably not that much new sex and relationships happening around this time, I would say. And also, you know, things like HIV and confidence is a massive thing. So the peer mentor service has actually seen a big uptick. I suppose one of the things that's happened is that sometimes it can be a barrier for people to come into our building, or it can be a real big step for people to meet face to face. But when we get somebody who refers himself was referred to us, chatting to somebody just over the phone is so much easier to do, and people don't maybe have the qualms that they would have about that. And you know, there's been a big uptick in peer mentoring over the phone, and in the main it's going really well for people. So out of all of this, I suppose that can be seen as a kind of silver lining that has lowered the barrier to access this support, and people who maybe wouldn't have considered it before are now able to access that. Another service, I didn't have a look at the time here, but I'll try and keep this as brief as I can, that we've devised especially for this moment is the telephone buddy service. We've been doing a ring around of all of our service users who are 55 and over, and that's hundreds and hundreds of people. And we've identified that, you know, a lot of people have become increasingly isolated as a result of having to shield, or just being really scared of going out and about if they've got, you know, complications with their HIV related health or other health conditions that mean that they're just at a greater risk of complications if they were to contract coronavirus. A lot of people lose their link and their lifeline to other kind of social connection, and that's so important. So our telephone buddy service is simply a trained volunteer who calls people up for 1 hour once a week and has a chat with them about whatever they want to chat about. That has been massively useful to people. We're really proud to be able to offer that service, but that can also feed back into our other services, because quite often they'll tell their telephone buddy about something that's going on with their benefits or about issues they've been having getting their food parcels or their medication, and then somebody like myself is able to step in and connect the people to the service about whatever the issue is. So that's been working really well, the telephone buddy service. Other stuff that's happening, we're still providing help and support around things like benefits. We've seen an uptick in people who have lost their jobs but have never navigated the benefit system. So they didn't even maybe apply for universal credit, you know, for a month and a half. So we're able to guide these people through the system and troubleshoot any issues that they might be having. And the kind of deprivation that we're seeing has just been magnified by this crisis. And a lot of the work we've been doing is applying to other charities on people's behalf, or helping them, you know, with small one-off payments from ourselves, or helping with benefits or housing issues. So that's a definite theme. I don't know what our colleagues at BHA in Leeds might say, and be interesting to hear in a wee while if that's something that they've experienced as well. But definitely the increase in that kind of real deprivation, but also people not knowing what they're entitled to or how to navigate that system has been a massive part of the work that we've been doing. Yeah, I think in the main that is kind of everything that's going on. What I will say is that if people would like to contact us, I will put our phone number and our web address and our email address in the chat here, and people can have a look at that. Right. We've also got an online chat function that's been manned much more often on the website, so you can just go onto the website, click the little chat button in the bottom corner and speak to somebody immediately if you need to.
Okay, thank you, Martin. Thank you. It was a very good approach and an explanation of everything, of all the service of Just House Trust. Just to clarify everyone about webinars, just the panelists will appear in the webinar. And so any other person that is now in the moment in the webinar, if they have any question, they just can write your question, and then will be answered in the end after Dr. Khine Phyu. Okay. And another thing, just another quick thing, India is the co-host representing all of the panelists. The area is our ABCD lead. in the Sexual Health Advisor at BHA, and she's the co-host with this. So now we'll be talking Chantel. Chantel works for BHA Manchester. She will explain about the service that we are providing now in the moment and the service that BHA Manchester has.
Okay, hiya. So BHA for Equality, we have a charity and we challenge the inequalities in health and social care. So that's working with non-British white communities across Greater Manchester. So I sit on the sexual health team, which is part of the PASH partnership. So PASH is passionate about sexual health, and that is a partnership between George House Trust, where Martin's just been speaking from, who provide support to people living with HIV, BHA, that's us, and also LGBT Foundation, and we offer the prevention side of the partnership. So we go across different communities and we offer activities, group sessions, one-to-ones, community testing, and access to free condoms and lube across the whole of Greater Manchester. Within PASH is the PLWHIV project, and the PLWHIV project seeks to upscale the work that the PASH partnership do. So they work in very much the same fashion, but in addition to that, we offer a membership scheme. So this membership scheme, it's a digital one, and it offers a tailored safer sex and risk reduction support. So that's through one-to-one sessions and group work sessions within the membership, and also access to scheduled free condoms and lube, and also free home sampling HIV tests. And the aim of that is just to keep the people within the membership to remain HIV negative, and have like more of a proactive stance on their sexual health and well-being. And just to note as well that the PLWHIV programme, the PLWHIV campaign, shall I say, that's across Greater Manchester as well, and that sits in line with the 1990 UN/AIDS ambition. So it seeks to end all new cases of HIV within a generation. So at the moment, due to COVID, we've not been able to go out into the community and do the interventions that we would have been doing, and that's due to obviously the social distancing and the organisations that we work with being closed down. So what we are doing is offering information and advice. If you send in an email to pash@thebha.org.uk, and I can also put these details in the chat function as well. If you send an email over, one of the team will get back to you and you can have a discussion about any advice and information that you need on sexual health. We also offer a free postal condoms and lube service. So if you go onto our website, there is an option there where you can click on the link and you can type in your details and order free condoms and lube. This service is for 18s and over, and also for non-British white communities as well. We're also, we're promoting as well at the time it's the HIV Prevention England Time to Test campaign, which was launched in June. And that is obviously due to COVID-19, a lot of people have been social distancing, and it's thought that it's the best time now to, look at identifying those who have not been diagnosed with living with HIV. So now is the best time to take a test, and that can then, help you get onto treatment as soon as possible, and also prevent onward transmission of HIV. So Time to Test, this campaign, if you go to freetesting.hiv, and I'll put the link in again in the chat function, and you can order a free test, a free HIV test, and this is open to everyone, just to get your test and know your status. Thank you.
Thank you, Chantel. Thank you for the update. Now we have Nyambi. Nyambi works in Leeds. We're going to explain an update about the service in Leeds.
Beth, just to say at the beginning that I work predominantly in the prevention side of the BHA Leeds client service. I know there's some support issues that Martin discussed. I wish there was somebody from our support team who would supplement those, but I think what you've been going through is similar to what this Skyline has been going through. So I'm a sexual health lead on the prevention side of the service. We have been in a situation where over the years we've been funded to work predominantly with African communities in prevention. We, like yourselves, found ourselves suddenly having to work from home. We started working from home on the 17th of March. And when we sat down, we quickly had to consider how we could still effectively be relevant to our communities in terms of, you know, giving them the services we were giving them from before. I think because community outreach work is slightly different in the terms that you have to get out there, as Chantel said, it meant we really had to see how we could adapt. But the adaptation comes from three fronts. It's us ourselves as staff adapting, and then looking at how our own communities, the ones that we engage, are also reacting to the environment, and also looking at the other stakeholders that we've worked with, the agencies who also engage the same communities that we engage, how they were also adapting their own services. So one of the things we did is to say, let's, you know, communicate with the communities we work with and see what's going on. Also, let's communicate with our stakeholders, agencies like the ones who work with migrants, including Migration Yorkshire, Leeds Migration Partnerships. How are they themselves adjusting? Looking at organizations like PAFRAS who work directly with asylum seekers, are they still going to provide a service? Is there a way we can still come in with what we were providing before? So we're looking at everything from those angles. And initially, because we can't hold face-to-face one-to-ones and group sessions, we decided that we should first of all inform everyone, all our stakeholders that were still here, in terms of advice, whether through our website or through a phone number we provided. We can still advise on sexual health issues. And we also initially sent out a leaflet saying we were able to provide free postal condoms. But that has gone now to a situation where we are working on that in conjunction with the Leeds City Council. We're now not only offering that service to people from the African communities, but the wider community of Leeds. So we have sent out leaflets, we have sent out our newsletter, which explains how we have adapted. We have included information of how they can condoms, apart from what is on the website, which Chantel alluded to. We have the flyers there on the website. We have sent out to, I think, over 100 organizations, stakeholders, you know, attaching our newsletter. Some of them have asked us to send links to our website and to send them the newsletter and information in such a way that they will upload them on their own websites. And we are fortunate that organizations like the Leeds Migration Partnership, which is actually an umbrella organization of so many other third sector organizations, were able to put a newsletter and flyer on their blog. Touched on another organization that works with marginalized communities, has committed to also uploading all our information onto their website. So in the meantime, we've been getting a lot of calls in terms of requests for condoms and conversations around what is going on. But we're also you know, aware of the fact that we had to treat carefully at the beginning, because we knew that a lot of people within the African communities we engage were very concerned about the effects of COVID within their communities. And that, as you could see, as the weeks went on, and it was confirmed that there was a disproportionate, affection of COVID-19 to the, to Bame communities, not only in terms of infection, but in terms of the poor prognosis when they got infected. People within their own communities were now discussing, what they should do, support within themselves, finance, and any other support they could provide within their own communities. So we're now actually also looking at the angle of, we've been talking to some of the members of those communities, looking at the angle of coming in with the issue of COVID, but at the same time bringing in the message that, now more than ever before, it's important for people to be thinking proactively about their general health, whether it means sexual health or other health issues. What should people do about those things in the future? We are aware that one of the recommendations from the public health reports, the second report, is that apart from looking at the factors that have exacerbated the inequities in the communities, we are also meant to play a role in going into these communities from an educational angle to look at how in the future we can react better to what has happened now. If there are any other pandemics in the future, how prepared these communities should be. So there should be some more proactive work, which we're agreeing on with other communities, with African communities, as to how in the future we should be able to work better and adapt better and ensure that they still get the services, we've been giving them. There have been a few people who have rang in for condoms, for example, or just advice, who are actually shielding at the moment. And so we appreciate that people are in very different circumstances, but most of them have our information, and when they are ready, and we anticipate after the whole period of COVID, there might be a big backlog of service demands, whether it's for testing, as Chantel said. We're also looking at the sampling kit issue with our commissioner, and whether it's for other things that people had held back because they didn't want to engage in this environment.
Thank you, Niambe. Thank you for all the explanation and to share with us as well the concerns with the BME community. So now we'll have to talk about COVID-19 and HIV. Dr. Khine Phyu, she's an HIV and sexual health trainee at the Leeds Hospital. Thank you, Dr. Khine, to be here with us. Please.
Thank you very much. Thanks for inviting me, and I'm so proud to be able to do this presentation and joining you guys. I'm going to share my presentation on the screen. Let me know if you cannot see it.
Yes, we can see it. Yeah.
Can you see it? Yeah. Okay, let me just try to make it maximize. So my name is Khine. I'm one of the HIV and sexual health trainees in Leeds Teaching Hospitals Trust. Unfortunately, I don't have any webcam in our office computer, so you could not see me. But you can see my presentation, which is actually better than seeing me in the workplace. So from what Martin and Chantel and Niambe had talked about how services quickly updated, and adapted to the safe way and get along following the government's advice. It's very impressive. It's very impressive to hear, how things could change, how people could adapt to this pandemic situation almost like overnight. But that's very impressive. My presentation is I try to make it into three patterns. One is like for people living with HIV, and the second part would be more like how do we test, like screening and prevention point of view, and the third part will be some myth about COVID-19, some do's and don'ts as well. So as the governments keep giving us an update like almost every day, the main thing is, as they say, stay alert. We just have to watch out. So let me start with my, I made this presentation as a very, very simple way. The first slide is about what is COVID-19. I'm sure most of us has already known a lot about this virus. So basically it's just a synonym of coronavirus disease, and which was found in 2019. So which was like basically December 2019, where the Chinese government started to announce that they found this new strain of virus. So it was born in 2019. And the SARS-CoV, you might see this synonymous somewhere. So it's a severe acute respiratory syndrome. I think some of us may remember about SARS back in 2003, 4 times, I think. So it's almost a similar situation that we are, but a bit more aggressive in terms of like pandemic spreading in nature. So it's basically a coronavirus family, but number 2 strain, which has been existing in the past as well, but it's mainly in the animal origin, never being found in human being up until now. But when it comes to human, it's actually spread faster than among birds. Can you imagine? It's basically a droplet infection. So when you sneeze, when you cough, when you any sort of body fluid and contaminate, could transmit this virus. As this is a very new infection, none of us has any immunity to it, and there was no vaccination before for this virus. So basically, the whole world has lack of immunity to this virus. And when it hits really hard to some people. The symptoms-wise, it's very variable. It's very difficult to predict as well. Some people has no symptom, but some people could have a very severe symptom like pneumonia that require hospital admission, that requires oxygenation and intensive care treatment. And unfortunately, there are some deaths, obviously, that we all being aware of. So common symptoms as up until now that we notice is fever and cough, but the cough is mainly like a dry cough rather than a productive cough. And there's a couple of new symptoms that the government recognize and announces: loss of sense of smell and sense of taste as well. But 80% of the people with COVID had very mild symptoms. So just 80% is quite a large population that you might think, but the amount of people being in hospital with the symptoms, can you imagine how many people have been infected out there as well? So how does it affect to our cohort? It affects us as like in the whole population. It affects in very different way. So up until now, so people living with HIV, but if they have a very well-controlled virus, like undetectable viral load, and achieve the normal CD4, which is above 200, and the evidence, there's not much evidence saying that they have a higher risk than the people, than the general population. But there are certain groups of people who are quite, could be quite high risks if they caught this COVID virus. So people who have a very low CD4, which we define as less than 200, people who are not on the treatment, or maybe on the treatment but not achieving the virus suppression, people who have other diseases such as like lung disease, such as COPD, and people who smoke, diabetes, people who have a chronic kidney disease or kidney transplant, people with heart failure, and obviously the cancer patients or those receiving chemotherapy, or people who have some immune suppression, for medication or for medical reason, and an older age group, which is above 70s, are defined to be a higher risk group than in compared to general population. When I say higher risk group, maybe they're easy to, prone to catch the infection, and as well as if they caught it, and it's kind of like a slower recovery, or they could have a poorer outcomes as well. So the things about the BME group, I'm sure you all have read and heard about these topics. And there are some research going on, but up until now, there's no clear evidence to explain why our community have higher incidence and poorer prognosis than the non-BAME community. So hopefully we'll get some, logistic explanation from some papers in near future as well. Any questions so far? Okay, good. As I make my screen large, I cannot see any chat. If you could shout out if any chat, people typing in. Okay.
Maybe we'll just, in the end,
yeah,
we'll
as a Q&A.
And answers.
Sure, that's great.
Okay with you? Yeah, okay.
Yeah. So, well, I put so many emojis on this slide. So what would we advise to our cohort, our clients? If they are on ART, they have to carry on taking it as usual, it's the best way to keep their immune system healthy and to avoid any other opportunistic infection. So what we don't want is we don't want them to be in hospital for any reason, during this pandemic. So have to continue taking their tablets. I've been hearing a lot about people increasing the dose, sharing the medication, but no need to do that. Do not need to increase the number of tablets that they take every day because they are on the appropriate dose. So that should be it. General advice, just have to, we are in this together. So we just have to eat well, sleep well, trying to reduce stress and do the regular exercise. If you can go outside, if you're not a high risk and shielding patient, you can go out for once a day regular exercise, get some fresh air and sunshine. Trying to cut down your social activities, obviously. I know the lockdown's been easing slightly, slowly, but we just have to be vigilant and be mindful about your own risks as well. So basically just keep an eye on what the Public Health England says. So every morning on the BBC news, if you use the apps, there are 5 things you need to know about COVID-19. It's good and quick, handy things to update yourself every morning. I've been doing it for the last 3 months. And that will just give you a new social distancing advice, new government advice, and also some sort of employment advice as well. So basically, I think hand washing and social distancing is the key here. And now the new rules is wearing the masks in some indoor places, especially in hospital and clinic. We all have to wear the masks in hospital as well. So there's a lot of confusion and a lot of phone calls to our clinic as well. I'm sure it will be the same to your services. Like, people don't know what to do, how things change. So a lot of queries call about what happened to their medication, what happened to their clinic appointment, and what happened to their follow-up blood tests, etc. So we are still here, we open. Especially in the beginning of the lockdown, we had a lot of calls every day. So make sure they have at least 30 days supplies of their antiretroviral tablets. Do not walk into clinic without having any appointment. Make sure they called us first. We are still open, but in a new system. And trying not to have too many people in the waiting room. We have a very strict appointment system as well. So if you think that, they might still open, but do not do any walk-in to our clinic, just call advance and book the appointment. We do see the patient face-to-face if we need to, but we would prefer not to, it's not only for our benefit, but also for the patient's risks as well. Like coming into hospital, using the public transport is still a risk. So always we triage over the telephone first. And if we have to see, we see it in minimal amount. So I'm sure the Manchester clinics might have done the same as well, or maybe in a different approach, but new system. So this is our Brotherton Wing clinic in Leeds, new system. So in Leeds HIV service, we have outpatient clinic in Leeds General Infirmary, which is a main hospital in Leeds city centre. And we have Wakefield and Dewsbury Clinic as well as a spoke site. These are other cities. The Wakefield and Dewsbury are closed, but we do it as a telephone. In Brotherton Wing, we can see patient face to face. We have updated our website with, we keep it up to date as well with what we're doing. So basically what we do is most appointments are over the phone. We arrange them on the phone, and if the patient is stable, don't need to see face to face, we arrange the medication supply, either delivery to the home address, to their address where they are temporarily living during the lockdown, or if they are well enough to come and collect it, they can come and collect it. But it will be a very quick, just click and collect service, by appointment only as well. So there's no shortage in medication. There's some rumors about it, but it's something that they don't need to worry about. And then from the telephone consultation, we will identify whether whether the patient needs a blood test or not as well. So there's an evidence, a good research evidence, saying if the patient is stable and on treatment, we can postpone the blood test for once a year only. We don't need to see every 6 months or every 4 months. So that's quite reassuring, because some patient wants to have a blood test regularly, but it's not something necessary. And obviously, if they're not well and any other concern, we can always arrange to see face to face. Okay. So what we do is we send the text message 3 days before the appointment, as usual, just send reminding that they have an appointment. On the same day, we send another text, additional text to say, do not attend the clinic if they have any symptoms suspicious of COVID-19, such as high fever, continuous cough, or loss of sense of smells and sense of taste. But a day before the appointment, we send another text saying these appointments are going to be done as a face-to-face or telephoned, because the clinician doing the appointment, they review the clinic list a day before, and they identify who need to be seen face-to-face and who can be done as a telephone, and they send out another message. So just keep an eye on the message as well. And if you change your telephone number, of course, you need to let us know. So this is a very interesting question, and I am glad that it was it was something that came up from Elizabeth when you invited me to do the presentation as well. So what do you do if you think you've been exposed to COVID-19? Basically, you don't need to do anything. If you develop any symptom consistent with COVID, you can call 111. I know 111 is very busy phone line, but don't hesitate to call and get some advice, because your GP won't be able to help you in that, and your HIV doctor is not available 24/7. So 111 is the point to call. And if you have any serious symptoms such as breathing problem, or consciousness affecting anything, you can call 999. And just have to mention that what symptom you are having, so that they can arrange PPE appropriately as well. Okay. Can the HIV treatment for the ARV be used to treat COVID-19? So that's such a hot topic these days. There's a lot of research going on about it. So currently, obviously, there's no vaccine or no treatment has been approved yet, but we are nearly there. Some of the HIV drugs being in the trial as well, in the COVID-19 treatment trials. We have not, the trials is not finished yet. They have not gone to the conclusion yet. So we could not say any yes or no for this answer. But we strictly don't recommend you to switch to any ARV that being in the trial if in view of like preventing COVID, or you do not share your ART to any other people in your family or your friends, anyone, in view of preventing COVID as well. It's such a wrong thing to do. Okay. The research is doing in the fastest ever speed. And then I'm sure we will hear something in a very, very soon. Okay, so that's another interesting question. It's about if you think you've been exposed to HIV during the lockdown, what do you do and what you should do? So, and again, the health services such as sexual health clinic, A&E, GP out of hour, we are still running, but in a new way. Just have to contact the, and get some advice. It is limited, but it is there. If you think you've been exposed, like immediately within 72 hours, and if you feel like you need a post-exposure prophylaxis, or if that's something that you're aware of, you can always call a sexual health clinic for advice. We have advice line in Leeds. We have the Leeds Sexual Health Clinic we have advice line, and I'm sure most of the sexual health clinics doing the same as well. If it is out of hour, A&E is always there. In Leeds, our A&E is being modified into like cold zone and hot zone. Hot zone is where the COVID suspected cases go, and cold zone is some sort of like a minor injury unit. So we try our best not to expose to each other as well. So fine. And if you're really feeling unwell and you think there might be the HIV causing all the symptoms, GP, sexual health clinics, and we are still running the service as well. And we prioritize to see, and we don't stop testing, but obviously it's a limited service these days. And the online testing, I put it on the top, but I'm going to talk a bit more about it. And I heard from Martin and Chantal as well. The online testing, and just off this morning, I got an email from my consultant saying we have got more online testing numbers, like free testing as well for both HIV and syphilis blood tests, and it's a free test kit that you can request online. So that's amazing. We've been trying to get more testing kits, and it's kind of something happened as a positive outcomes from the pandemic, I have to say. So yeah. This is our Leeds Sexual Health Clinic. So it depends on which gadget you use. Your PC or your mobile or your Samsung or your Apple, whatever, might look slightly different. But this is when you Google our sexual health clinic, this is the first thing that pop up. So you call that number, go through the advice line, and then they can forward your call to the nurse in charge who's triaging over the phone, and then booking you as a telephone consultation or face-to-face, or signposting you for the online testing as well, depending on what service do you need. So
Great.
Some myths. I'm not sure if you guys have any myths about this virus, which we did in the beginning a lot. Is it a seasonal flu? No, not as your seasonal flu. It's 10 times more lethal. So don't take it, well, take it serious. Is it airborne? I'm not sure if you know what airborne and there's a difference between airborne and droplets infection. Airborne is something that can be multiplying in the air, growing in the air. But no, it is a droplet infection. So it's transmitted from contact or close contact from droplets or aerosol infection. How long can it live on the surface? So that might help for your cleaning protocol. So we don't know how long, but basically on the hard surface, they can live longer than on the soft surface like your fabric and stuff. So hard surface, easy to clean, just wipe them off. That like the fabric and stuff, the soft surface, we're not very sure about it. Less well on the cloth and the fabric. So does it not survive in hot weather? Not proven yet. We don't know. So don't take the sun as an advantage of easing down the lockdown. Face masks, not 100% protected, but there are some degrees of protection wearing face masks, but need to know how to use it appropriately, take it on and off, because you don't want to be, contaminate with your hands. So when you wear the face masks, that means you prevent yourself from infection from somebody else, and also you are preventing, giving the infection to someone else as well. That means that face mask is like a barrier, like a shield. When you touch it with your hands, your face mask, assume that your face mask is dirty, don't touch with your hands. So you need to know a proper way of taking on and taking off. There's some videos online quite helpful to know. Do you need to take the vitamin C and D to boost your immunity to help against all this virus? Taking vitamins is no harm, but check with your doctors, check on the Liverpool apps to make sure there's no drug-drug interaction with your regular medication. Mother-to-child transmission. Well, we have our cohort with pregnant mothers really worried and really nervous about going to hospital, attending their antenatal clinics, and deciding where to go for delivery, and thinking of home delivery and all these stuff. It's very controversial. There's no clear data, no evidence yet, and we used to think that COVID's not a children or babies family virus. There's no evidence as such yet to answer this question. Okay. But the maternity units are doing their best in kind of like following the cleaning protocol, appropriate PPE, asking the mothers to self-isolate for 14 days before attending for delivery and potential, expected delivery dates and stuff. That's my
just to let you know that we just have 5 minutes to the end of the webinar.
Yeah. Sure. I'm nearly there. Okay. So at the moment there's no vaccine yet, but it's in the trial and is coming very closely. So just encourage ourselves as well to get our routine vaccines, like annual flu vaccine. If you haven't had a pneumonia jab, you should have a pneumonia jab if it's recommended by your doctor. That's about it. Okay.
Thank you.
Thank you.
That was great. Thank you.
So if you have any questions.
I just gonna see here if we have any other questions, because we just have now 5 minutes. I'll just do 2 questions, and then after I'll ask all the panelists to do like a final statement, like 1 minute maximum.
Okay.
It's okay. So the first question that I would like to ask is about, we know that people are disproportionately affected by coronavirus. Should they shield themselves if they have HIV, although it is not recommended to shield when they have HIV? And then the question for everyone, we know that they all say that we have a great time, a great opportunity to end the HIV transmission because of the lockdown, so now time to test. So any one of the panelists to answer me why is a good time to test, and what the general concerns of service users when they call to the service. So just like everyone, if we could like 1 minute to answer this question.
So question for that, one is, why is the best time to test? It's, it's no such best time to test. We should just test it and get to know your HIV status. It's a key. But if you get tested early, diagnosed early, and get onto the treatment, that is always an optimal outcomes. But it's just a matter of facts, which service you want to go for, or in the safest ways as well.
Just to echo what Khine was saying as well, it's important to know what your status is. The sooner the better, so you can get onto medication. But also, as I explained earlier, due to the social distancing that people have been doing over the past 2-3 months or so, it's the perfect time to find out what your status is if you've been adhering to that, because you've not put yourself at risk of acquiring HIV. So yeah.
Exactly. Yeah, it's window period has passed, isn't it? If you're following the social distancing and lockdown guidance. Yeah.
Martin, Yambe, don't know if you want to say something. We have another question as well. Are there any people living with HIV involved in COVID-19 trial?
I am not entirely sure, because I've not been much involved in the research. I think it's all volunteer. There might be some people volunteer and approach for that, because it has to be in different layers of population. I am not entirely sure if they particularly approach the people living with HIV to join the trial.
Thank you. Any concerns that the service users have been sharing?
Can I just, I know it's not, some of the communities that we have been having a chat with, concerned about, we can't avoid conspiracy theories sometimes, and we have to make sure that we give the correct information if we can, and if we have it. Because there are people who are concerned about, they're looking back at the time when, at the advent of HIV in those days, there were also various kinds of theories about what was going on, and whether there was more HIV in certain areas, and why people were having it more than others, and so on. So there is a kind of correlation currently with some of the communities thinking that, they might be affected by COVID because of, similar to how they were affected by HIV in the olden days. And, people used to talk about the fact that it's come from a vaccine, it's come from some older inoculations that were taken to Africa. And there's been some conversation even now about people saying, even if we are concerned about our health, but we don't want to be the first ones to be given the vaccine when it comes out. There is, and this is correlated with the Burma community being concerned about how they've been affected by COVID. So there is some assurance that we need to give to people about what is going on, although it's quite difficult. And in terms of the vaccine that is going to come soon, there are people who are holding out and saying they're not going to have it unless they're absolutely sure that it's not meant for something.
Sure.
How do we assure people?
It's a difficult question, isn't it? It's so there is always a group of people who anti-vaccine. They don't like to have any vaccine, or people don't trust the new medication, which has come up very quickly in action to pandemic. But when they produce the medication and release into the market, it's been going through 3 different stages of the research trial, like first step in the lab, second step in the animal or any sort of model, and the third step in the human being in the men trial, and then they have to pass all these steps to make it safe to give into the community. So I think that's the way of best reassuring. But there is always people who are allergic to drugs, you know, any new drugs. It's yeah, I think there will always be a myth about vaccination in community. But as of high risk group, I think when the vaccine is coming out, they will be approached first to get the vaccination.
I don't know, Martin, if you'd like to do a final statement as well. And then it's also my last question, because it's already 4. What's your opinion on why BAME community is so badly affected by COVID?
Sorry, can I just say before that, this has been absolutely lovely and I really welcome the opportunity to be involved. I'm going to actually have to go as I have another appointment going on at the moment, but thank you so much and very interesting, Dr. Khine. So thank you everybody else from BHA as well, and I'll see you all soon.
Thanks, Martin.
Thank you, Martin. So this is maybe just to answer the last person that asked your opinion, Dr. Phyu, about the affected. And we'll end the session.
Opinion on why BME community is so badly affected. Yeah, as I said in my presentation as well, we are not very sure about the clinical factors why BME groups being badly affected. There's no clinical outcomes, evidence to explain that, but there could be so many factors, such as like lifestyle factors as well, and the way our family live, like we live in the same roof with our elderly and our parents, kind of like more like extended family live together quite close as well. There might be some social factors as well as the clinical and genetic factors involved. It's hard to say without having any evidence. Yeah.
Well, thank you everyone to be here today. Thank you, Nyambe, Martin, Chantel, Lindia, and everyone that is here as well with us. And we'll see next time, and we'll send.
Thank you. The last thing is that I think that Beaver and Terence Higgin Trust has updated it just of yesterday about some advice and corrections on the shielding advice as well. So if you guys have a look on Beaver website or Terence Higgin website, they released a new statement yesterday.
Great, thank you all.
Okay,
thank you.
Thanks. Bye-bye.
Bye.
Thank you. Bye.
Bye.